Hi, this is Dr. Doreste with the Cranial Release Technique, and it's finally a beautiful spring day here in New York City. It's been doing nothing but rain here, and I'm happy to see the sun. Everything is very green. Beautiful day. I wanted to comment, I went to the dentist the other day. I needed a filling repaired, some bonding work. And then if you've ever had that type of work done, when the dentist is finished, we now have to adjust the bite because they put too much material, so the tooth is now higher. In this case, it was a lower tooth. The tooth is higher than it should be, so they have to now grind down that little bit of the filling material until the bite is correct. The problem is, of course, is that most people have a cranium that's already distorted. And of course, as the cranium distorts, there are two bones in the head, really where the jawbone connects. It's called the temporal bone. And you may have heard the concept or the term TMJ, or temporomandibular joint. That is the jaw joint where the skull and the jaw meet, right here. So why am I even talking about this? Well, in my experience, most patients, if the cranium is rotated or distorted one way or the other, that is going to affect and impact the TMJ, the temporomandibular joint, and therefore affect the mouth and the bite. In addition to other things, let's just speak about the bite for a moment. The actual act of chewing and aligning the bite. The next time you have a moment, you can play a trick with your friends or family, your spouse, your children, your husband, wife, your mom, your dad, and just have them stand in front of you and very gently place your fingers inside the ear canals. And when you look at your fingers sticking out from their ears, you'll probably see something that looks like this, or like this, or one finger will be forward and one finger back, or the other way, or some sort of a combination. And right there, that tells you that this person would benefit from the cranial release technique. In addition to that, because the ears are misaligned, here comes a garbage truck, so that's what happens when you do a live video. When you do a live video outside. So, as the ears are misaligned, you say, well, that's no big deal, so what? Because really you're going to see it on everyone. Keep in mind that the jaw will be misaligned, and therefore the teeth will be wearing down differently from one side to the other. So if you are a dentist watching this and you'd like to learn more about the cranial release technique and why it would make sense for you to apply the cranial release technique to all your patients prior to doing dental work, or having someone on staff learn how to use the cranial release technique, visit the website. That's cranialrelease.com. You can click on the online training program and take a look at that. And if you're a patient and you're having some dental issues, you might want to pay a visit to a cranial release technique practitioner. Let them take a look from a cranial release standpoint. We're not doing anything inside the mouth. That's not our domain. We want to align and open the cranium so that everything works better, including the jaw and the mouth. So again, cranial release technique is the name of the actual modality, the hands-on technique. Cranialrelease.com. You can search for a practitioner there. Cranial release, and it's impacting the impacting power that cranial release can have on dental work to enhance what the dentist is attempting to do. Take a look into that. Check it out and let me know what you find. Cranialrelease.com. This is Dr. Doreste saying adios, my friends. I'll see you on the next video. Goodbye.